I simply love a cup of coffee in the morning to get started. But what about preconception? What about if you're planning for pregnancy? Can you still consume coffee or tea in the morning? Or does the caffeine contained in these beverages impair your fertility? Well, there have been quite a few studies in recent years assessing this aspect of preconceptional lifestyle. And the good news first, when it comes to a certain amount of coffee or tea, there is no data hinting at negative effects. Up to 300 to 500 milligrams of caffeine per day, however, seem to be the threshold from where things change. This corresponds to roughly 3 cups of coffee per day. If you drink less, if you consume less, no problem at all. If you consume more, it can have detrimental effects for your fertility. Initially, experts thought probably coffee is also a symptom of a certain hectic and stressful lifestyle. But today we know it's really the caffeine in the coffee that has the negative consequences. For her, because we know today from studies on mice that the caffeine actually has a regulatory function for the muscles of the fallopian tubes. It inhibits muscular activity of the fallopian tubes and thus makes it more difficult for the fertilized egg to reach the womb and implant there. For men, we know that high coffee consume can lead to decreased amount of spermatozoa in semen and can also affect the genetic health of the sperms. In pregnancy, on the other hand, we know that women should completely avoid any caffeine consumption. Caffeine can pass the barrier between your blood system and the baby's blood system and can thus have a direct impact on your developing baby. It can impair not only its sleep pattern, but also its development in a very direct way. So, in summary, during preconception, it is perfectly okay to drink 3 cups of coffee or tea per day without having to fear any harmful impacts. However, if you do consume more on a regular basis, try to reduce your consumption to approximately 3 cups. During pregnancy, however, we ask mothers to completely avoid caffeine containing beverages such as tea or coffee for the sake of their developing baby. If you want to read about this in more detail, please visit our blog here. And if you're interested to learn more about preconceptional lifestyle and nutrition, it would be really nice to welcome you back again here in our channel.